Hi, welcome to my YouTube channel, Orthodontics by Dr. Kieran Daly. Today we're going to talk about treatment of an anterior open bite in a teenage patient. The patient we're going to talk about is Niamh, who presented at 16 years of age. Niamh had all of her adult teeth, and you can see from both her photographs and x-rays that Niamh had a significant open bite with no overlap of her front teeth. This was a concern from an aesthetic perspective for Niamh herself, also from a long-term functional and dental health point of view. It's better if we can create contact between the front teeth or incisors. Niamh's treatment started with the use of what we call a hybrid appliance. This uses advanced orthodontic technology to first of all create a guide to place two very small temporary implants about 1 centimeter behind her upper front teeth. Initially we used the temporary implants as an anchor for a hybrid expansion device. The expansion allowed us to create the correct width in the upper arch, which was too narrow, and that allowed for more room for the alignment of her teeth, and also it helps with the correction of the open bite by aligning the back teeth first. Niamh also had an abscess in her upper left first permanent molar tooth, which was subsequently removed. And from there we fitted her train track braces to straighten and align both her teeth and to improve the bite. After about 15 months of treatment, we have now improved the alignment of Niamh's teeth. However, there still remains a certain amount of open bite with no overlap or contact on her front teeth or incisors. At this point, we remove the hybrid expander and we replace it with a second hybrid appliance that's called a mousetrap appliance. The mousetrap appliance has two parts or components. There's the hybrid appliance that's attached to the implants, and a second part called a palatal bar that connects the molar teeth at the back. We then connect both parts of the appliance with some elastic chain, and this helps to control the position very accurately of the upper molar teeth. It creates what we call an intrusion of the molar teeth, and this allows the bite to start to close at the front. So after 3 to 4 months of use of the mousetrap appliance, you can now see the incisor teeth coming closer together, and eventually they have come into contact, creating the correct fit of the bite, also known as the occlusion. This is very important for long-term dental health and function, particularly of the teeth, the gum tissue and the jaw joints into the future. Once we had created the correct occlusion, we were then in a position to remove Niamh's braces, fixed appliances, as well as the temporary implants. And you can see in the final photographs that we've created the correct alignment of the teeth, much improved dental and smile aesthetics. We've had a significant improvement in her facial aesthetics, reducing down the facial height at the front and allowing her lips to become competent again. Why it's important to correct an anterior open bite or to create the correct fit of the teeth or bite. The reason why it's so important is that in a patient with an anterior open bite, they only have contact on the molar teeth at the back. This means that the molar teeth are under significantly increased pressure or forces when chewing, or particularly if the patient grinds their teeth at night. And in the long term, it can create a lot of wear on the teeth or any fillings or restorations that the patient might have. As the patient gets into their adult life, this can create significant dental health issues. Additional to this, patients who suffer from temporomandibular jaw joint discomfort or dysfunction often only contact their teeth on their back teeth, and this condition of temporomandibular joint dysfunction is much more common in patients with anterior open bites. So the early correction of an anterior open bite in a child or teenage patient allows for much better dental health as well as temporomandibular joint health into your adult life. In summary, the treatment that we provided allowed us to create a broad smile with optimum aesthetics without having to change the surface or the shape or form of these teeth.